എല്ലാവർക്കും എഡ്യൂക്കേറ്റേഴ്സിന്റെ മറ്റൊരു വീഡിയോയിലേക്ക് വെൽക്കം. In this video, we are going to discuss about what examiners check in Oski, New Zealand, then critical errors, and why failure rate is high, tips for passing, and also it's like what about the job vacancies and current status in New Zealand. Let's watch. Firstly, we can see what examiners check in Oski, New Zealand. Examiners here use a checklist. For each and every station, they use a checklist and they are checking like what the skills or what the things you show. So the first one in the checklist, the first one is like knowledge and clinical skills. In that they are going to check like correct procedure. നിങ്ങൾ കറക്റ്റ് പ്രൊസീജിയർ ആണോ ചെയ്തത്, അതായത് സ്റ്റെപ്സ് ഇൻ അസസ്മെന്റ്, ഇന്റർവെൻഷൻ, അതുപോലെ തന്നെ ഡോക്യുമെന്റേഷൻ. പിന്നെ ആക്യുറസി ദേ ആർ ഗോയിങ് ടു ചെക്ക്. Example, right drug, right dose, right road, and right patient. Then, use of equipment safely and correctly. കറക്റ്റായിട്ടുള്ള ആ ഒരു രീതിയിലാണോ വേയിലാണോ നിങ്ങൾ ആ എക്യുപ്മെൻറ്റ് യൂസ് ചെയ്തത്, അത് സേഫ് പ്രാക്ടീസ് ആണോ എന്ന് ദേ ആർ ഗോയിങ് ടു ചെക്ക്. പിന്നെ the final one, following NCNZ scope of practice and guidelines. Whatever the things you do, everything should be within the scope and the limits. Then the second one, communication and the professionalism. Clear introduction. You have to greet the patient. You have to give clear explanation to the patient. You need to introduce yourself. Then informed consent. Informed consent എന്ന് പറയുമ്പോൾ നിങ്ങൾ ഈ റിട്ടേൺ കൺസെന്റ് ഒന്നും എടുക്കേണ്ട കാര്യമില്ല. But you need to take a verbal consent. Either you can ask like, are you okay? അതും ഒരു ഇൻഫോംഡ് കൺസെന്റ് ആയിട്ടാണ് കാണുന്നത്. Then respect for patient autonomy. അവരെ നമ്മൾ റെസ്പെക്ട് ചെയ്യുക, അവരുടെ ഇൻഡിവിജ്വാലിസത്തിനെ നമ്മൾ റെസ്പെക്ട് ചെയ്യുക. Then therapeutic communication, active listening, show empathy, then reassurance. Always use the empathetic word, then listen to them, explore their concern, and give reassurance. Then professional behavior under pressure. നമുക്കറിയാം, നമ്മൾ ആ ഒരു എക്സാമിന് വരുമ്പോൾ യു ആർ അണ്ടർ പ്രഷർ. കാരണം ടൈം ലിമിറ്റ് ഉണ്ട്, 8 minutes, യു നീഡ് ടു പെർഫോം എവറിഥിങ്. ബട്ട് ടേക്ക് എ പോസ്, ടേക്ക് എ ഡീപ് ബ്രീത്ത്, ദെൻ try to control yourself. Show your professionalism. Everything like, don't be nervous and don't be panic there. Think like you are a New Zealand nurse. You are treating a real patient. That's what they are saying, like it's a real simulation or real examination. So think like next one, cultural safety and legal or ethical practice. Respecting patient values, culture and rights. Treat your identity principles, partnership, protection, participation. You are considering them as a partner, protection. You are protecting their cultural safety and privacy, and also participation. You should involve family and the patients to be in the decision making. So explore their concern, consider their wishes. According to that, active listening, show empathy, give the reassurance, and find the solution. Privacy, dignity, and confidentiality maintained. Specifically, wound assessment or some other stations, പ്രൈവസി മെയിൻറ്റെയിൻ ചെയ്യുക. നിങ്ങൾ ആ ഒരു കർട്ടനൊക്കെ ഇട്ട് കൊടുക്കുക. കാരണം നമ്മൾ ആ ഡ്രസ്സ് നമ്മൾ ഒന്ന് ഓപ്പൺ ചെയ്തതായിട്ടൊക്കെ വരും. അപ്പം നമ്മൾ കർട്ടൻ ഇട്ടോ അല്ലെങ്കിൽ വിൻഡോ ക്ലോസ് ചെയ്തോ എന്നൊക്കെ ഒന്ന് മേക്ക് ഷുവർ ചെയ്യുക. സോ യു നീഡ് ടു മേക്ക് ഷുവർ പ്രൈവസി മെയിൻറ്റെയിൻ ആൻഡ് always think about the confidentiality. Then appropriate delegation or escalation to other health team members. Always delegate. If you can't do, delegate. Then divide the duty and responsibility some other healthcare team members. Then always adhering to NCNZ code of conduct. So you need to make sure like what is code of conduct. Then next one, critical errors. So if some critical errors in your exam, directly you may fail. So first one, medication error. In New Zealand, they are not going to accept any kind of medication error. First one, wrong patient, wrong drug, wrong dose, wrong route, wrong time. Then not checking allergies. You have to always ask like any allergies there or not. Also like check the medication folder. In the medication folder there is a space to write the allergies. That's the doctors, they are going to do that. But like you have to check like whether it is filled or not. Then not following the 8 rights of medication. So you need to familiar with all those things and follow this. Then infection control breaches, not washing, sanitizing hands at key moments, Breaking aseptic technique, specifically when you are touching the patient, when you are doing any clinical procedure, please do that. Then not using PPE appropriately. If sterile gloves or something need to be used, try to be, or give the rationale if it is not there. Then failure in patient safety, leaving patient at risk, maybe but not lowered, side rails not up if required. It's like, check when you are entering the room, check like everything okay or not. Then do accordingly. Then if anything you needed, ask for help, not calling for help in an emergency. Then ignoring vital signs that show deterioration. In the deterioration station, that's what like they are assessing. In that, if any vital signs like in the EWS score, it's not in the limit, you need to escalate. So please watch our EWS chart video. You may get more information from that. Then cultural safety breaches, disrespecting or stereotyping Maori or other culture. So stereotyping means some of the candidates what they do is like they will study everything, they will check everything, they will learn some more one or two words. Then they are just recording that one without any feeling on their face. Just they are using that one. They know like, oh, this is should be used. But അങ്ങനെ ചെയ്യരുത്, that is not proper way. Then ignoring patients' expressed wishes or not involving Panau when appropriate. If patient says something, respond to that. Active listening, explore their consent, reassurance, don't ignore them. Then, using insensitive language, always use please or it's like a polite approach. Then, professional or legal breaches. Breach of confidentiality. Always keep like all the information and everything should be confidential. Then, acting outside nursing scope. I was saying that one. Everything should be within the limit. Then, unsafe delegation. Example, giving medications or IV meds without authority or delegating to the wrong person. That should not be. Then, why the failure rate is high compared to other countries or compared to some other countries' examination. New Zealand Oski failure rates are very high. Um, Actually, they are not giving much feedback, but we are expecting that. But in our point of view, might be first one is like they are having high cultural safety expectation. So because New Zealand places huge expectation on breach of vitality, cultural safety, and partnership with Maori. So that's what like when you are applying for the exams or the New Zealand Council, they are sending a video about cultural safety and cultural things. So please watch that. Try to understand. If you not sure, ask someone. They can help you. Then because they need to merge cultural safety, clinical skills, communication, professionalism, everything together in a plate. Then next one, nervousness and performance pressure. Like within the time limit we need to be, and like someone is assessing us. Might be you feel nervousness, but try to control. Take a pause, take deep breath, then try to be confident, cool, and like think like you are a New Zealand nurse and you are treating a real patient. Because being a nurse, we know like whatever the circumstances or whatever the situation comes, we do accordingly. So do like that only. Then time limits they already know, but try to control like not yourself and try to be competent. Then different practice standards. You all are like practicing from some other countries and coming here, they can understand that one, but like be familiar with the New Zealand scope of practice and standards. Then even small lapses in infection control, communication can be classed as critical areas. So different practice standards in that might be documentation styles, medication protocols, delegation rules, but be familiar with the New Zealand culture and the New Zealand standards. Then strict patient safety standards. They are following the strict patient safety standards. So might be I was saying to you before, like any even small lapses in infection control, like a septic technique, if you are not following, might be considered as a critical error. Then communication, use the good language, appropriate language, polite, and everything you should show in your exam. Then not practicing realistic scenarios. Many candidates they study theory but don't practice in simulation, like with the timing. So try to do the role play or mirror practice or ask someone for help. Then, tips for passing. Success is not only about knowing the procedure, but also showing safe, professional, cultural, competent nursing practice under observation. So they are going to check everything together. So please try to understand all the things what I was saying. This is might be this all the things they are expecting. So try to make yourself competent and be win. I hope like you everyone can like success in your exam. And the final one, like what about the job vacancies here? ശരിക്കും ഇപ്പോൾ കറന്റ് ജോബ് വേക്കൻസീസ് വളരെ കുറവാണെന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ അവർ ബിസിനസ് ഒന്നും തന്നെ ഒരു ഓഫർ പോലും അവർ കൊടുക്കുന്നില്ല. പക്ഷേ might be things may change in future. There will be a vacancies. But New registration, it is very important and like അത് ശരിക്കും ഒരു വാല്യുബിൾ ആയിട്ടുള്ള ഒരു രജിസ്ട്രേഷൻ ആണ്. ആൻഡ് ഓൾസോ you can apply for like a job. You can apply in both countries like Australia and New Zealand. So best wishes in your exam and hope for the best. Thank you.